Ladies and gentlemen, my name is Ewa Mrukwa and I'm representing the University Clinical Center in Katowice, Poland. And today I'm here as a replacement of Professor Mrukwa. She couldn't attend this great meeting due to her health problems. So today I'd like to share with you our experience regarding the EBK procedure in refractive error correction. The history of laser corneal surgery begins with the introduction of excimer laser in 1980s. As to the beginning of refractive surgery in Poland, the first procedure with the use of excimer laser took place on January 1990 in Katowice Clinic, while the first LASIK procedure was performed on April 1997. As we all know, the PRK is a procedure with when the excimer laser is used to reshape the anterior layer of the corneal stroma. The cons of this procedure include postoperative pain, long rehabilitation period, the possibility of corneal haze, and error regression. As to LASIK, it is characterized by a temporary corneal flap preparation, and the cons include flap-related complications and risk of ectasia. In our hospital, for a couple of years, there is a reversion to superficial techniques, mostly due to flap-related complications that our operators have encountered. Also, the PRK has a higher safety for thin corneas and eyes with Bowman's membrane dystrophy. As to flap-related complications, that can be divided into intraoperative ones, including corneal perforation or bleeding, early postoperative, for example, the dislocation of flap, a foreign body beneath the flap, and late postoperative, including corneal inflammation and epithelial ingrowth. These are some of our patients and our complications. This patient has a flap dislocation in both eyes with a partial reepithelialization. On the bottom of the screen, you can see the realignment procedure. As to the superficial technique, for operator, the most important part is the first stage of the procedure, so the epithelium removal. There are different methods to it. You can divide them into mechanical and chemical ones. Generally speaking, the quality of corneal surface after the epithelium removal has a substantial influence on the postoperative effect and tissue healing. As to EBK, it stands for epithelial Bowman's keratectomy and is an initial procedure of epithelium removal in refractive surgery that offers an optimal condition for laser treatment. In our hospital, we use the epikeratome EpiClear by Orca Surgical. The use of this epikeratome is characterized by fast and complete epithelial removal, and that leaves smooth surface without any residual cell fragments. As you can see on the screen, the Orca's epikeratome removes specifically the epithelium cells, posing no damage to Bowman's membrane, in the contrary to manual techniques. The device itself is simple, has a disposable tip. It's made out of biocompatible non-metallic materials. I have a short movie with the entire procedure. It might take some time to start.
If you could speak a little louder, people in the back, okay? During your video.
Okay, so this is the beginning of the procedure. You can see the epikeratome tip. Generally, as I said, the procedure is short. Is characterized by high precision, thus enables fast regeneration of the epithelium cells, and result in patient's comfort. As to presbyopia, around 1 million people suffer from presbyopia worldwide, and of course it has a negative effect on quality of life. There are different approaches regarding the corneal laser refractive surgery that aims to create some sort of a multifocal cornea, for example via laser ablation, as is the case in presby-LASIK. Other approaches include corneal inlays, conductive keratoplasty, and intracore procedure. As to the superficial technique, I guess the most valid option is monovision, so optimization of non-dominant eye for near vision. There has been papers reporting similar or higher satisfactory rate for a permanent laser monovision versus contact lenses monovision. And it was mentioned early this morning. There is a paper by Artola and Alberto published in 2006 claiming positive side effects for PAK in myopia. They considered that the corneal aberration induced by the PRK for myopia may reduce the quality for distance but enhance the near acuity by way of a multifocal effect that can delay the onset of age-related near vision symptoms. As to our study, to my knowledge, there was unfortunately there was not a single patient who underwent the EBK procedure strictly to gain monovision. So our study includes 120 eyes patients who underwent EBK refractive surgery in 2014-15 for reduction of myopia. The age range was from 21 to 48 years old, so early presbyopic, some of them were. The inclusion criteria were normal structure of anterior posterior segment, stable refractive error, intraocular pressure below 20 millimeters of mercury, correct field of vision, corneal endothelial cell density above 2000 cells per square millimeter, and normal morphological structure. The exclusion criteria included, for example, the systemic autoimmune diseases. The assessed parameters were eye-corrected and best-corrected visual acuity for distance, refractive error, keratometry, pachymetry, and visual quality. As to the results, the refractive error at each given point in time throughout the observation period, the values of refractive error were statistically significant compared to values prior to operation. As for the spherical values, the average spherical error prior to operation was minus 3.1 versus minus 0.3 at the end of the observation period. And as for the cylinder, it was minus 1.2 and minus 0.4 respectively. As for the uncorrected visual acuity for distance, the average prior to operation was 0.1 and at the end of the observation period it was nearly 1.0. As to the best corrected visual acuity, it remained stable throughout the observation period. Also, the keratometry and pachymetry values were statistically significant, with the smaller minimum value of pachymetry observed being 390 micrometers. As to the patient satisfaction, it was generally high, approximately 94% satisfaction rate. The satisfaction rate were higher for questions regarding near vision acuity. It was around 96 to 97% compared with distance visual acuity ranging from 90 to 94%. To conclude, according to our experience, the ABK method in refractive surgery for myopia is high efficient, stable, has a great safety and high patient satisfaction rate. Thank you for your attention.